today's video, we're going to talk about an underappreciated aspect of cardiovascular disease development, and that is blood viscosity. And hopefully, if I do my job of conveying the science to you, you might be more motivated to donate blood frequently because blood donation can decrease blood viscosity. Blood viscosity is arguably one of the more important drivers to the development of cardiovascular disease that goes unnoticed. While the whole world is focused on cholesterol, which is arguably sort of the smoke, the fire is being caused in your arterial system and in your heart by thick, viscous blood. And a lot of people don't know this. And I will say, friends, for my male clients, it's 9 in 10 male clients have indicators of high levels of iron and blood viscosity. And we're going to talk about how you assess that, looking at very simple components of your complete blood count, your CBC, namely the hemoglobin and hematocrit. I would say, honestly, a 9 in 10, maybe 9.5 in 10 male clients that I've worked with since 2006 would highly benefit by donating blood. And half of our conversation oftentimes when we review labs is encouraging them to donate blood. Now, it's not so common in women. It's more about, say, 5 in 10 because women have been sort of donating blood for most of their lives via menstruation every single month. You know, women who menstruate obviously are shedding blood, and that is helping to decrease their iron and their hemoglobin, hematocrit, and decrease their blood viscosity. Now, we're going to talk about what blood is. It's a non-Newtonian fluid. It doesn't behave like water. Its viscosity changes. And this is a very timely and apropos conversation to have for a few different reasons. Number one, there's a virus that's circulating that tends to disproportionately increase blood viscosity. And it might be the challenge or cause the challenges in the post-infectious window that are linked with cardiovascular complications. We hear about long-haul COVID might be related in a large part, due to blood viscosity during the infectious period, and how excessive exercise in the post-infection window or the post-protection window, if you catch my drift, might be something to consider, especially if individuals are complying with mandates. I want to share with you some tips that could potentially help you due to the data and what we understand with blood viscosity and how walking, going in the sauna, potentially donating blood might help individuals and reduce the potential increases that could be had in the post-infection window when it comes to blood viscosity. So we're going to get into it. We're going to draw upon 2 papers. This paper, it's widely available. It was actually published in February of 2020, curiously, right before, and I'm not suggesting a conspiracy, but it's like, this was so timely, published in February of 2020. But guess what? It's only been referenced 8 times. And this, there was a lot of great authors on here from multiple universities and so forth. The title here is The Role of Blood Viscosity in Infectious Diseases. Again, this is pre-COVID. It's been known, Sir William Osler, we're going to talk about some of the things that he found in people. And one of the treatments, the early 1900s, if people had a severe pneumonia, because they knew that blood would get really thick and they might have a stroke or a heart attack, they would do bloodletting, right? And that would enhance survival. And we're going to share some quotes with you on that. But this paper, phenomenal. The role of blood viscosity in infectious diseases. Now, this is important because we know that individuals who get infected with SARS-CoV-2 have a lot of immunoglobulins, IgM, IgG, various cytokines, fibrinogen, D-dimer, and so the blood can become very thick and viscous. And if you're already overweight, pre-diabetic, and you have thick, viscous blood, of course, that's going to be more shear stress and more peripheral vascular resistance. You're going to get, right and left ventricular hypertrophy and challenges and potentially clots and deep vein thrombosis and potentially strokes and things like that. So this is a free therapy, friends. You can go donate blood, and it doesn't cost you a dime. It takes 30 minutes or 40 minutes of your time. If you don't like needles, that can be a problem. But again, if you do your labs and you look at your labs and you're like, wow, my hematocrit is 47. I'm not racing in the Tour de France. You don't need to be running around living life as an American, as a non-elite athlete with a hemoglobin and hematocrit that are very elevated. That is just increasing the viscosity, the viscousness of your blood, okay? So that's where we're going. Another paper that was just recently published here, the detrimental role of elevated blood viscosity in patients with COVID-19. Again, this was published in May of this year, 2021. We're going to share some quotes from these papers and dive into it. So what in the heck is blood viscosity? How do you measure it? A flowing fluid such as blood can be envisioned as an infinite number of parallel layers sliding against each other. So there's an image that I'll share with you right here. So viscosity results as a friction between the adjacent layers. The shear rate of a fluid is the difference between the velocity between any two of these layers divided by the distance between them. Viscosity is a ratio of shear stress defined as the force applied to a fluid divided by its contact area and shear rate. And so in a low viscosity fluid, a shear stress and shear force results in a high shear rate and low flow and high flow viscosity. So here's this image here. You can see a lot of space between the different layers, and that would be minimal shear. And then on the right is going to be more shear. And so the shear gets more pronounced in the periphery. And so that's where you see more varicose veins. You don't see oftentimes varicose veins on someone's shoulder. It's often down on their legs, right? Where there's more shear stress and changes there. So really interesting stuff. Viscosity is measured in a funny unit that I've never actually thought about called a centipoise, CP. So it's a measurement used of a dynamic viscosity in the centimeter gram second system of units. Hyperviscosity is a problem. So that's the centipoise if you want to get it tested. I believe in one of our first podcasts we did with Dr. Ralph Holsworth back in 2014. I mean, this was, he's a doctor that I've known for a very long time, 15 years almost. And he created an assay with Dr. Jonathan Wright here in Renton, Washington. And I don't know where, I'll do some digging before I post this podcast and put it in the show notes. They created a blood viscosity assay. I think it was great. It was a little early, like not too many people were onto this. And I just shared a post here on Instagram earlier today, and the response, people are like, yeah, I want to hear more about this. What's up with blood donation? What's up with blood viscosity? And I've been wanting to cover this topic, and I've been diving into these articles, and I'm like, we just got to cover this. So anyway, there is an assay out there, but here are two parameters to look for in your complete blood count, which is your CBC, which should be a part of your Chem 24 and CBC and differential when you go to your doctor for your annual physical, or that you should be measuring at least once per year, friends. You have to do labs once per year. It's like getting your credit check once per year to make sure you don't have like parking tickets that have gone to collections or something like that. Like, you're crazy if you don't check your credit. You're crazy if you don't check your bank account. And you're crazy, if you don't do labs at least once a year. Now, if you're 21 years old, maybe it's every 2 to 3 years, but especially after 30, you want to get a good baseline so that if something changes, there's a sudden drop in albumin, there's a sudden increase in your lymphocytes, there's a change in your C-reactive protein, and you're like, wait, what is going on here? You can get ahead of the curve, okay? So that you don't just walk into the clinic when you're 60 and you have a whole list of problems, and go, gee, I had no idea I had prediabetes, diabetes, fatty liver disease, all of this, right? So get your labs done, friends. We have a course coming up the second week of November. The blood work cheat sheet can be helpful as well. That's free, but the course is going to be paid. We have 3 live webinars during the month of November, and we're going to dive into this and help you understand and interpret your labs so you can work with your doctor and get more information about that. So I'll put links there below. But blood viscosity, super, super important. Let's get into it and talk a little bit more about this. And I just want to welcome our new listeners back. It's Mike Mutzel. As always, I'm grateful that you're here. Thanks for tuning in. Thanks for hitting that like button. Please leave a comment below. That tells the algorithm, hey, if you like this content, then this other person, Joe Smith, Sally Smith, might like it too. That goes a long ways. Plus, I would like to know if you donate blood and if you have any resistance to donating blood. A lot of people learn from the comments. So share your comments and let us know if you've donated blood and what that feedback has been. Also, friends, I do just want to let you know that we have a great new electrolyte rolling out here at our sister company. Now, the early pre-sale for that ends this month. So what's unique about this electrolyte sticks, it's a stick pack featuring red mineral salt, magnesium, potassium, calcium from Albion Labs. Also, you get taurine and creatine. This has been studied by scientists, but never put together commercially. We're one of the first companies to put together a multi-ingredient combination electrolyte product that can support your body's healthy hydration response and exercise performance. So there's an amazing offer that expires on the 31st of this month. When you buy one bottle, you get the second box of 30 stick packs, 100% discounted. So you buy one, get one 100% discounted. That's part of the pre-sale. It ends on the 31st. I'm telling you, this is a phenomenal deal. Definitely check it out. Go to myoscience.com. That's MyoXcience.com. Check it out. Okay, so let's dive into these studies. This, to me, so fascinating because everyone's like, whoa, eating healthy costs money. Gym memberships cost money. Anyone can donate blood, okay? Anyone, pretty much. There are some nuances if you just had a tattoo, if you have AIDS. I mean, there's some things, right? There are some exclusions, but by and large, most people can donate blood. The challenge with blood viscosity and infections is where I want to focus in on that. So increased blood viscosity contributes to the association of acute infections with myocardial infarction, which is a heart attack. That's the $50 million way of talking about a heart attack. Venous thrombosis, which is a clot in your venous system, and venous thromboembolism, which I believe is a clot that goes into your lungs and very problematic. You do not want that. Blood viscosity also increases vascular resistance, which decreases tissue perfusion, which might be why people are, I can't breathe, I can't catch my breath, like I need to be on a ventilator, right? Because if your tissues are not getting the oxygen, then the feedback to your brain is going to be like, wow, we have hypoxia. We need to increase ventilation responses, right? And this activates, stretch receptors in the left ventricle in the heart, thereby initiating systemic vascular resistance responses. Now, blood viscosity is like a dog chasing its tail. It's a vicious cycle that increases more and more viscosity, especially in the post-infection window. And this, my friends, might be one of the complications with COVID-19 and severe disease, where people already have viscous, thick blood. They have increased viscosity from the infection. And I want to share with you what this image has found here. So this is figure 2 of the paper that came out in February of 2020. So what you see here is immunoglobulins. I want to focus on here because this has some implications with regards to mandates and considerations of blood donation before complying potentially with the mandates or what have you. Because immunoglobulins, we hear so much about antibodies, like, oh, they're so protective, we want to higher the better. But immunoglobulin antibodies like IgG, IgM, that would happen in a post-infection window or after an immunization can impact viscosity, right? And so this is just something to be aware of. Other factors like inflammatory factors, cholesterol, triglycerides, platelet aggregation, these are things that can increase viscosity. So again, really important stuff to consider. So having prolonged, super high levels of immunoglobulin antibodies, I mean, the body's unique, right? And this is naturally why you see antibodies start to decline, like people who've had a natural infection to whatever microbe you want to fill in the blank with, their antibodies are high for a while, then they go down. Because if they were persistently high, that would create more shear stress within the cardiovascular system. So having excessively high prolonged antibodies could be a cardiovascular complication, right? As protective as it may be to prevent a reinfection, the plasma cells can remember those antigenic signatures and kick up and increase antibody production when needed on demand, okay? So I thought this image was really, really good. Okay, so what other diseases, as we continue on here and talk about infections, I want to share with you quotes from Sir William Osler and things like that, but what other diseases are related to blood viscosity? So I got this from a website I will link over here. This is not like a peer-reviewed academic article, but they do summarize some of the clinical studies that have been conducted. So diabetes. So numerous clinical studies have shown that type 2 diabetes have higher systolic and diastolic viscosity than healthy non-diabetic individuals. Okay, well, think about one of the complications and underlying health conditions linked with poor outcomes with the current public health problem. Diabetes, hyperglycemia. We've been talking about that. I've drilled that into your minds and shared with you the science numerous times. Stroke. Stroke is a complication. Strokes and cardiovascular related issues were among the top cause of mortality. If my memory serves correct, I think it was 690,000 people in the US alone during the year of 2020 died from heart attacks and strokes and cerebral vascular disease. So the Edinburgh Artery Study, the largest clinical trial on blood viscosity ever conducted, showed that high blood viscosity was linked with stroke. Heart disease, again, heart disease, strokes, and cardiovascular issues, number one cause of mortality in 2020, even during the COVID-19 outbreak. So the largest blood viscosity study ever conducted was part of the Edinburgh Artery Study in the 1990s, which followed individuals for a number of years, and they found that blood viscosity was linked with death from heart disease. All cardiovascular disease in general is all linked with increased blood viscosity. So why does blood viscosity cause a strain on the heart, right? Now you know how to measure it. Now you know that blood gets very viscous in the post-infection window due to the inflammatory byproducts, TNF-alpha, and some of these inflammatory cytokines, and also immunoglobulin antibodies. IgM is one of the first to increase, right? IgM, then IgG antibodies increase after that. So you can imagine Again, you have, Bob Smith, overweight, pre-diabetic, eats McDonald's, never exercises, doesn't ever go in the sauna, has thick, viscous blood. He's dehydrated. He doesn't take electrolytes, whatever. And then he gets COVID, right? So you can see his tissues aren't getting oxygen. He's hyperventilating. Like, what's going on? He's inflamed, right? So you can see here a bad problem. Now, if Bob would have just exercised, went for walks, compressed his feeding window, didn't eat dinner at McDonald's, didn't have soda, had a low glycemic index diets, high glycemic index diets are increased clotting factors in the TNF alpha and the interleukin 6s, those cytokines that can make blood more viscous and potential to clot. They affect fibrinogen, the thrombocytes that create the clots. So again, we don't want to be consuming fast food, friends. I see the Chick-fil-A, the Jack in the Box, the McDonald's. As I drive to the gym, their lines are through the roof. I mean, one of the worst things you can do in terms of promoting thick, viscous blood and clots and so forth is eat processed food and then go sit on an airplane. How many times have you been on an airplane where you see people crushing McDonald's and they're traveling for 6-7 hours? I mean, it's just insane. So this is more quotes here. These increases in erythrocyte aggregation, which is caused by sludging of blood in areas of low shear in the coronary circulation, veins, and microvasculature, can lead to thromboses or clotting. Coronary thrombosis occurs in association with several infectious diseases and even immunization. Okay, YouTube, don't get mad at me. I'm reading from a paper, right? These aren't my words. This is from the science, okay? In the early 20th century, Sir William Osler noted that right ventricular dilation, a common complication of coronavirus 19 in response to hyperviscosity caused by infection. Okay, where are the public health experts recommending freaking blood donation? I know there was a shortage of blood. Okay, as noted above, increased blood viscosity increases the risk of thromboses. Inflammation also creates a procoagulant state via several other mechanisms, including thrombocytosis and increased concentration of circulating tissue factor. The risk of myocardial infarction remains elevated for 10 years following severe pneumonia. This is interesting. So again, people who have had severe long-haul COVID or a mild case and maybe returned to intense exercise too quickly, and they have thick viscous blood, they could have maybe caused some microvascular damage. I'm not really sure, but that's interesting to consider because people do respond differently, but people's bodies are different. Some people don't know because they've never run labs that they have a hemoglobin hematocrit that is off the charts. Like I said, 90% or 95% of the males that I work with, this is the case for them. And they don't even know it. And I have to convince them. And they just got their labs back from a doctor oftentimes. And the doctor doesn't mention it because it's not on their radar, right? Who's promoting blood donation? It's free. No one's making money saying, hey, donate blood, right? Who makes money off that? Exactly no one. Okay. So sluggish blood flow is one of the 3 factors that causes thrombosis, as identified by the German pathologist Rudolf Virchow in the 19th century. And others being hypercoagulability and abnormalities within the vessel wall. Increased blood viscosity creates a prothrombotic state by creating large areas of slow blood flow. So blood is just slow, it's sluggish, it's like molasses, right? You don't want your blood to be thick like molasses or like honey that's been sitting there for a while. You want it to flow smoothly without shear. Those shear stresses are not only creating that peripheral resistance within the microvasculature system, but they can damage the vessels as well. Okay, so as we finish up here, increased blood viscosity associated with severe pneumonia was noted by Sir William Osler in the 20th century. Before the advent of antibiotics, therapeutic phlebotomy, which decreased blood viscosity, was still routinely practiced by some physicians. Osler noted, we employ therapeutic phlebotomy much more frequently now than we did a few years ago to bleed at the very onset in robust, healthy individuals in whom the disease sets in with great intensity and high fever is good practice. Let in the course marked dilation of the right heart is the common indication. Very interesting. So that you can see here, people who have severe pneumonia, there's a dilation in their, I think it's the right ventricle. So you can see here in the late course of a severe infection like pneumonia, there's a marked dilation in the right ventricle, which is not a good thing. You don't want enlargement and dilation and sort of fibrosis and things like that in your heart. This is not a good thing. Okay, so carrying on here, the clinical course is consistent with a rising IgM antibody titer and increased blood viscosity due to the primary immune response, also to immunizations as well. So again, I'm not saying immunizations are bad. I'm not saying don't get immunized. I'm just saying we need to be aware of the fact that, there could be, something to consider with regards to supraphysiologic levels of antibodies. People should just be aware of that, especially people who are already prone to having thick, viscous blood. Okay, just be aware of that, right? Remind your friends and family, especially, if they don't exercise, if they already have sort of the pre-diabetic, overweight, metabolic syndrome characteristics, before they go and get their booster shot, they might want to donate blood beforehand and make sure they're well hydrated and make sure they exercise and move, right? We could really help some of these people by reminding them of this information, I think, especially because it's free. Just go and donate your blood. Okay. As a consequence of this marked immune response, plasma viscosity can also be extremely elevated in COVID-19, as much as 4.2 centipoise. Now, I don't know how that references here, but the normal range is like 1.4 to 2. So it can increase almost fourfold. So the risk of thromboses, decreased perfusion, and increased vascular resistance, and areas of low shear predisposed to thromboses because of decreased shear mediated expression of these molecules and so forth. And what was interesting is one of the shows that we did about 2 weeks ago, we talked about L-arginine as a potential natural therapeutic for individuals. And I think it was a study in Minnesota. It was somewhere out on the East Coast found, and they randomized people to 2 different groups. They gave one group a placebo sugar pill. The other group that was in the hospital, 1.5 grams of L-arginine. We know L-arginine increases endothelial nitric oxide synthase, eNOS. eNOS helps to expand the vessels, and therefore to decrease the vascular resistance, potentially decrease the shear if blood viscosity has increased. And they actually had an improvement and left the hospital early compared to the group who got the sugar pill. So it's sort of linking up all these different things we've been hearing over the last 20 months, different bits and pieces and so forth. But I think if we sort of figure out that, wow, blood viscosity is a central theme that's problematic, and if we can address it and especially get out in front of it, knowing that this virus is never going away, I think that's a good thing. So there's a decrease in the influx of molecules with antithrombotic activity and so forth, like we talked about. So this German scientist identified that sluggish blood flow is one of the 3 main factors for thromboses in the 19th century. So people throwing a clot, having clotting complications, sluggish blood flow can be part of that. Thick, viscous blood is going to be synonymous with sluggish blood. So really interesting stuff here. Finishing off, I think we just have a few more paragraphs, friends. I think this stuff is so fascinating. Again, the take-home message here, get your labs. If you're already an anemic young individual, maybe not important, right? Especially for women who are still menstruating, maybe have a history of anemia and things like that. So you stand up and you get dizzy. This conversation might not be totally applicable to you. But for men, especially men who kind of have they're red in the face, they have a little bit of a belly, high blood pressure, those are generally the men that I found that very much would donate from blood donation. This can be 1 or twice a year. You don't want to overdo it. You don't want to go every week, okay? This can be once or twice a year and just see, and then remeasure your ferritin, your iron, your TIBC, your hemoglobin, hematocrit, RDW, see where that's at. Again, if you're like, what did he do? He just said all these acronyms. Go to highintensityhealth.com, download the blood work cheat sheet. Now, once you opt in, I send you a few different emails to let you know more about blood testing, continuous glucose monitors, hemoglobin A1C monitors, and also more about our paid webinar that we're going to do in the month of November. We're really going to dive into blood work to help you better understand this. So I'll definitely check that out at highintensityhealth.com. Okay. The German scientist Virchow identified sluggish blood flow as one of the 3 main risk factors for thromboses in the 19th century. The others being elevated concentrations of coagulation factors and defects in the vessel wall. Thrombosis is a common complication of COVID-19, like you just heard about, which was identified early in the pandemic. Have you ever heard about this? I mean, to be honest, I haven't heard much about coagulation until kids started having strokes. I want to say it was August of 2020. We started to hear a little bit more about that from the media, but it took a while, okay? So thrombosis is a common complication of COVID-19, So in the aforementioned study of plasma viscosity in COVID-19, all patients with plasma viscosity greater than 3.5 CP, which is the measurement, had thrombotic complications. They go on to say in a registry of over 1,100 COVID-19 patients, the prevalence of major arterial or venous thromboembolism was 35%. Okay, the prevalence of a major adverse cardiovascular event was 46%. Interesting stuff. And the prevalence of symptomatic venous thromboembolism was 27% in intensive care unit patients, despite prophylactic anticoagulation therapy in most of these patients. So really interesting stuff. Now, there was no thromboses in individuals who were not hospitalized in this particular subset. So again, individuals who are hospitalized tend to have more severe disease, more complications, obesity, diabetes, hypertension, and much more. So in a series of 100 consecutive echocardiograms performed at the hospital on COVID-19 patients, the most common echocardiographic abnormality in these patients was worsening of the right ventricular dilation and shortening of acceleration time. Shortening acceleration time is suggestive of increased pulmonary vascular resistance. Not a good thing. Overall, 39% of patients had right ventricular dilation had normal left ventricular systolic and diastolic function. These findings can also be suggestive of pulmonary embolism. So to me, fascinating stuff. So what do you do here? Well, a lot of people ask about supplements and proteolytic enzymes and things like that. Yeah, I think that can play a role, but I don't think that's more powerful in any way than just donating blood and getting the viscosity down. The enzymes and things can be helpful. There's Wobenzyme. There's a lot of enzymes out there, serrapeptidase and trypsin and chymotrypsin, and there's a lot of stuff that you can take. But stay hydrated. Walk, especially after a meal. So when you eat, there's a little inflammation that's being created, even if you're eating healthy, real food. You can help to mitigate that by just taking a slightly vigorous 10-minute walk and just drop down that glucose. We know that glucose excursions, insulin excursions can improve, can increase the clotting mechanisms and the inflammatory state. So we want to be aware of that. Getting a good night's sleep. So we know that sleep alterations can affect the immune system. So try not to, have social jet lag. And on the weekends, as I record this on Friday, a lot of people go out and they party and they have fun and all that, and they stay out till 1 or 2 in the morning and have this circadian rhythm disruption. We know that circadian rhythm disruption can increase risk for heart disease, and that might be due to potentially viscosity changes, but also just the circadian rhythm. So we want to be aware of that. I already said walking. Sauna and heat can be helpful because it's affecting those endothelial cells that comprise the microvasculature in your cardiovascular system. So it's like an exercise to them. It's like putting your heart, the cells that make up your heart and arterial system on a treadmill, right? You're telling them to do some work and they become more pliable. And so there's been several studies in individuals that, just put heat pads if they have diabetic peripheral vascular disease, and they put heat pads on their legs, they get improved blood flow and oxygenation in their legs. So if you have a hot tub, access to a sauna, access to a steam room, whatever it is, or go lay on the beach, something like that, grounding. I know it sounds a little woo-woo, but that could be helpful as well. And of course, donating blood, especially if your hemoglobin, hematocrit are elevated. So that's it for today, friends. I think this stuff is fascinating. Again, it's free, it's practical, it's applicable, it's timely, especially as we get into the winter, where there's all sorts of pathogens that increase in their, circulation and so forth. And we want to be aware of this. We want to help our friends and family get more healthy. So hopefully you found this helpful. Consider blood viscosity. Put that on your radar or something to strive to improve in this next year. Especially get some labs as well. Good labs can help you help with that. So thanks as always for tuning all the way in. Hopefully you found this helpful. I will link some of the articles that we talk about and the images in the show notes on our website. And we will catch you in a future episode down the road. Have an awesome day. Bye now.